in my experience over the last 20 years in the hospital that I've been attached to, the maximum number of disorders that have come to the hospital definitely are liver disorders after joint disorders. And they have come after running from pillar to post, visiting different hospitals, trying to find a solution for that. Well, not all of them were alcoholics, but when you talk about liver, you always tend to associate it with alcohol. Not all of the liver disorders that came to us were alcoholics. Some of them were working in the mining areas, some of them were exposed more to the heat or working in kitchens, some of them have been just lay people who have never done anything bad in their life to create toxins into the liver. That triggers a bell that says, that rings a bell that says it must be something in the food that is actually causing troubles for the liver. Liver is called as the policeman. Policeman because it allows only certain substances to be, your blood to be sent into circulation. It is the cleanser, it is a primary cleanser. So it will allow only certain materials to be running into the blood system. And because it is a cleanser, it has a huge effort to be done into removing out substances which should not be sent into circulation. Most of the cases that we have treated so far are cases who were told to have a transplant of liver or who were advised to undergo a transplant. There are some cases who had come to us which were a phase before transplant, who had a lot of ascites, accumulation of fluid inside the abdomen. Just keeping them on a very rigid dietetic regimen and adding a few herbs to their treatment, at the same time purging them, giving medications, has been the 3 steps that we worked on, which we have observed have been very, very helpful in the recovery of the health of the people. When we talk about transplants, it is the latest thing that has come around which people talk about transplant. But we have been having these disorders for over 10,000 and odd years, as mentioned into the books. So in those days, there was nothing like a transplant. The entire scenario of transplant was non-existent. Yes, modern surgery has advanced immensely for the benefit of the mankind. But how many of us can afford a transplant? And how sure are we that our bodies are going to accept the transplanted substance, whether it is the liver or the heart or the kidney, whatever it is. So in order to allow the body to accept that, we are pumped in with more number of medications and chemicals, and the body has to work again on accepting the transplant, at the same time fighting against the chemical substances which intervene the normal physiology of the body. So liver disorders is the primary disorder which Ayurveda looks at and has a treatment for as well. Yes, we have not published a lot of papers, or there's been no lot of research that has been published out so far. But what I see in my day-to-day observation, I don't think I have treated 2 cases with similar medications ever in my 20 years of experience. Every time I have come across, there has been definitely a different approach to the person, because he comes as an individual. He's not a general layman, or he's not someone who's same as the other person. He has his own physiology, or she has her own physiology, and that needs to be understood before starting any treatment. Just as your food, your likes, your choices, everything is individualized, your medicine also has to be individualized. It cannot be generalized.